Hello, good morning everyone. I'm Leomy Villena from BSN 1201, and for today I will execute the 4 techniques used in assessing the patient, starting with inspection, palpation, percussion, and then auscultation. Let's start first with the inspection of the client's appearance and mental status, and then followed by the inspection of the female external genitalia. Okay, let's start. Good morning, Sir Villena.
Good morning, nurse.
How are you today?
I'm great.
How are you feeling today?
I'm feeling fine.
Okay, that's good to hear. Can you describe me your normal day starting from waking up until going to bed?
I wake up around 4 to 4:30, 30 minutes of exercise, doing my chores, I shower, I eat, and go to bed.
Okay, that's good. You've mentioned that you're doing a 30-minute exercise. Is it every day or not?
3 times a week.
Okay, that's fine. How is it? Is it light exercises or vigorous exercises?
Vigorous exercises like jogging around 10 kilometers.
Okay, that's great. How about your diet? Are you into light or soft diet, or you prefer solid foods?
I prefer solid foods.
Okay, fine. I think that will be all, Sir Villena. Thank you so much. Okay, in inspecting the client's appearance and mental status, we have to be not too obvious because it may bring discomfort to our patient, and we must not tell the patient that we are observing them because they may alter their actions. Okay, when the client starts entering the room, start observing, and then continue observing while you are asking several questions. Then observe for the posture and facial expression. So as I can see, the client has no facial distress or distress in posture, no frowning, no bending over due to abdominal pain, no labored breathing. And then inspect for the client's body build, height and weight in relation to the client's lifestyle. So the client has a big body build and it is in proportion with the client's lifestyle. And then observe for the gait and posture like walking, sitting, standing. So as I observe, there's no tremors, no unbalanced gait, and the body movement were all coordinated, and no slouching or bending of the back. And then observe for the overall hygiene of the patient and the grooming. So the patient appears to be neat and clean. And then note for any signs of odor like breath and body odors, or there is no foul odor and there's no acetone breath odor. And then lastly, observe or note for any signs of health illnesses, especially in the skin and the breathing pattern of the patient. So there's no labored breathing, no weakness in breathing, the skin is well nourished and intact. So as we can see a while ago, the client has a fair white reflection, there's no paleness, the skin is well nourished, and there's no weakness in breathing and no lesions as well. Now we will inspect the female external genitalia, starting first with the pubic hair. So inspect for the amount, characteristic, and distribution of the pubic hair. So it is distributed in the form of inverse triangle, and it is kinky. So there is no stunting of the pubic hair and there is no extending of it to the abdominal area of the patient. Now let's wear gloves, and because we might be in contact with the vaginal discharge. So in inspecting the skin, slightly separate the labia majora and the labia minora. So inspect for inflammation, redness, swelling, and lesions. So as we can see, the skin is intact. So the labia is full, round, and symmetrical. The vulva area is slightly darker than the rest of the body. And it has no inflammation, scars, lesions, fissures, swelling, or redness. And then while we are separating it, let's inspect the clitoris, the urethral, and vaginal orifice. So the clitoris is not exceeding in 1 centimeter, and the urethral orifice appears to be a small slit and is the same color than the same color as the surrounding tissues. There's no signs of inflammation, redness, swelling, or any discharge. Now we will proceed in palpation. We have to palpate the carotid arteries of the patient, and we have to be extremely careful. So in palpating the carotid arteries, we have to palpate one at a time because to prevent blocking the blood flow of other arteries that is going up to the brain, and we have to prevent too much pressure and massaging the area because too much pressure can occlude the artery, and carotid sinus massage can precipitate bradycardia. So sir, can you please turn your head to the opposite side so that I can have a full vision of the area? Okay, thank you sir. So using the finger pads of your index and middle finger, put it to the artery. Okay sir, face towards me. Okay, thank you sir. So as I can see, as I can feel, the pulse volume is symmetric and the arterial walls were elastic. There's no hardening or thickening of the arterial wall, and the pulse is in full pulsation and have a thrusting quality. So the quality does not change even though the patient is turning his head, and there's no increase or decrease in pulse. And now let's proceed in percussion. So we will percuss several areas within each 4 quadrants of the abdomen to determine presence of tympani sound and dullness. So tympani sound indicates gas over the stomach and the intestine, while dullness indicates that there's solid mass or solid masses or fluid under the abdomen, such as the liver and the spleen. So we will use a systematic pattern in percussing the client's abdomen, starting from the lower right, then counterclockwise to the upper right, upper left, and then the lower left quadrant. So we will use both finger pads of our index finger. So one is in direct contact and then the other one will be on the topping. Sir, okay, I will now percuss your abdomen.
Okay, nurse.
Okay, let's start. So here, in the intercostal, here's the liver. Okay, now the spleen. Okay, so I hear a tympani sound over the stomach and gas-filled intestine or gas-filled bowels. And then I also hear dullness over here, which lies the liver, and then here, which lies the spleen. So I don't hear dullness over the bladder because there is no urine field of the bladder. And then I didn't hear any large portion of dullness that may indicate tumor. For the last technique, which is the auscultation, we will auscultate the anterior thorax or the anterior chest of our patient. So we will use the diaphragm of the stethoscope to auscultate the area. So we will start in the apex of the lungs, just slightly above the clavicles, and then down to the bases of the lungs, which is in the 6th rib, right here. So okay sir, I will now begin auscultating your chest. So, but before that, I just want you to breathe through your mouth with a complete respiration cycle. Okay, sir?
Okay, nurse.
Okay, breathing through mouth will prevent sound transmission that may occur during nasal breathing. And sir, if you will experience any pain or any difficulty in breathing while I'm auscultating your chest, just let me know, okay?
Okay, nurse.
Okay, so let's start. Okay, breathe through your mouth, sir. Okay, so the breath sounds is normal, which is the bronchovesicular and the vesicular breath sounds. So there is no abnormal breath sounds like wheezing, which is generally termed as the adventitious sounds. Okay, that will be all for the four techniques, which is the inspection, palpation, percussion, and lastly, the auscultation. Thank you very much.